We started with our electronic health record implementation about 3 years ago, and our goal was to improve the way that we manage information related to care of our patients. The previous paper chart-based system led to inefficiency and difficulties in even locating the patient chart at the time of the visit, and not having test results in the chart at the time of the visit. One of the biggest advantages of the electronic health record is the availability of information that is necessary to provide care for the patient at the point of care at the time that we're actually seeing the patient. We receive test results through the Delaware Health Information Network through a computer interface, and those test results are automatically filed in the patient's chart and in my inbox the minute they become available from the lab. We also have high-speed internet at the point of care, making it easy for us to obtain further information regarding tests that may be performed by other physicians on our patients, which ordinarily wouldn't be available to us without a phone call or sending a records request. These are also available through the Delaware Health Information Network. The documentation of our progress notes is in an orderly fashion, and it includes a complete medication list with every progress note. The medication list is reconciled at the time of every visit and represents up-to-date medication dosing, something that was frequently missing from our paper progress notes previously. The electronic health record has improved communication between my staff in the office. Even though we have a small office, messages fly back and forth between myself and my staff members. They go into inboxes, allowing us to respond to those messages when it's convenient for us. And of course, the chart is always available without anyone having to look for it. During our patient visits, using the electronic prescribing module that's in the electronic health record, we can send prescriptions for patients directly to pharmacies so that they don't have to drop them off. At the time that we send the prescriptions, it creates a notation about that prescription in the patient's chart and automatically updates the patient's medication list, something that we would have to do in triplicate previously using paper charts. The electronic prescribing function also allows us to automatically fax our prescriptions to pharmacy benefit manager companies right from the workstation here in the examination room. So we don't have to use paper and run it through a fax machine. We just click and it goes through the computer fax, eliminating steps of work for our staff. The electronic health record allows us access to our patients' charts from remote sites. I can dial into our system securely, remotely from home, and do work in the evening time or in the morning if I choose to, or on the weekend, without having to physically come to the office. If I'm away for a conference, I can also dial in securely through virtual private networking through the internet with no concerns about security due to the encryption, and again access my test results, mail that I receive that's scanned in by my staff, and also allows me to communicate in real time with my staff without having to use a telephone. This is by the messaging that is occurring through the electronic health record. This is a big advantage for a physician in solo practice because I don't have partners here to cover me while I'm away, so the remote access is actually key.
One of the best things that I like about EHR is when patients call for a message, they're returning a message, you don't have to get up and look for the chart, try to figure out who called and the little tiny pieces of paper that are always lying around somewhere. You just click the button, look on the patient manager, you know instantly who left a message and what the message is, and you can talk with the patient instantly about their phone call. So from a billing standpoint, I like the idea of going on to the, I send a file up one night, I put all the charges in, the next day I could come in and go on to the clearinghouse website and instantly see if there were any problems or errors that were made on the claim and fix them right then, resubmit it to the payer, and the claim gets adjudicated within 2 weeks. The money's in the bank. I love it.